side event of the UN Commission for Social Development. And I'm Toshio Obi, moderator of this forum today, and showing data. So we have many co-organizers, sponsors, like Japanese government, Ministry of Internal Affairs and Communication, and Foreign Ministry's Permanent Mission of Japan to UN, and the International Academy of CIO, NGO Committee on Aging, New York, and of course UN DESA. So these are co-organizers, co-sponsors, and we have 6 speakers and 2 commentators. I couldn't see yet the Dr. Alexander from Moscow yet, but definitely he's coming. So first, I'd like to introduce Mr. Makiguchi, the Director General of the MIC Ministry, for Honorable Yoshida, Vice Minister. Makiguchi氏のビデオお願いします。西村さん。
Hello everyone, my name is Makiguchi Eiji. I'm the Director General of the Global Strategy Bureau, the Ministry of Internal Affairs and Communications of Japan. I'm honored to be able to speak at this seminar today, and I'd like to express my appreciation for the initiatives of the United Nations Department of Economic and Social Affairs, Dr. Obi Toshio, Professor Emeritus at Waseda University, and Dr. Iwasaki Naoko, Professor at Waseda University. Due to the COVID-19 pandemic, our lifestyles have changed. People have found themselves under unfamiliar restrictions, and even the movement of people has been curtailed. As a result, the economic growth rate of 2020 is expected to be minus 4.3% according to the World Bank, and worsening risks still exist under the continued circumstances. In terms of employment, ILO indicates that more than 93% of workers in the world have been affected by workplace closures, and 8.8% of working hours, which is equivalent to 255 million full-time workers in the world, have been lost in 2020. Facing these challenges, the world needs to achieve the United Nations in 2015. In particular, the digital agenda is focused under the restriction of human contact because of the outbreak of COVID-19, and we have been mobilizing digital technologies to maintain a wide range of socio-economic activities ranging from education to healthcare, labor, and commerce. Last June, the roadmap for digital cooperation presented by the UN Secretary General Antonio Guterres provided us with a direction for global cooperation in digital technologies, which can contribute to achieving the SDGs and solve social challenges. Japan expresses its respect for the leadership of the Secretary General in this matter. Within this context, Japan has started a joint project with ITU called Connect to Recover for strengthening digital infrastructure and promoting digital use in Africa to assist in curbing outbreaks of COVID-19. Japan will continue to commit to the UN's efforts. Japan has also been impacted by the COVID-19 pandemic. At present, a state of emergency has been declared for major cities in Japan, and a number of workers are asked to stay home and do the telework. Under these circumstances, various efforts are being made to maintain Japan's socio-economic activities. The Ministry of Internal Affairs and Communications, MIC, supports the introduction of telework at companies via free consultations by specialists along with support system in local communities. Also, MIC has started its research for building the support system for the ICT usage of the elderly people who would have high risks of seriousness by the COVID-19. Under Prime Minister Suga's administration, the government has decided the basic principles of reform for creating a digital society. The goal of this decision is to achieve a society in which the needs of each individual can be met through the use of ICT and where a wide variety of happiness can be realized. Japan will continue to work towards international cooperation in this respect. Now let me explain some of Japan's efforts to assist digitization in other countries. Firstly, we are supporting Japanese business operators who engage in building the quality infrastructure with its expertise in terms of increasing internet traffic during the pandemic. For example, JICT, a public ICT-related funding agency, has decided to support the construction of submarine cables that connect Japan, Guam, Australia, and in the Southeast Asian region. Our digital solutions are another example for digital countermeasures against the pandemic. We have successfully implemented telemedicine initiatives in Brazil, Chile, South Africa, and other countries. We are also providing the telehealth care system using smartphones for pregnant women in Ghana and achieving agricultural efficiencies in Colombia and Botswana by using ICTs. Japan will continue to contribute towards achieving SDGs for the entire world through encouraging and providing support for the digitization of all countries. Under this pandemic, people have been suffering as infections have spread. But in contrast to the past pandemics, this time we have a new tool of digital technology, and it has enabled us to maintain a certain level of socio-economic activities despite various other restrictions. Because of COVID-19, we have lost many things, but at the same time, we find ourselves presented with many new opportunities. I believe that it is our mission to take the lessons we have learned from this crisis and apply them for the future. And as such, we will continue to work towards the realization of the digital agenda and the achievement of the SDGs. Thank you very much for your attention.
Thank you very much for Japanese government to join us. And, since the time is very, very limited, and I'd like to introduce the speakers from Japan, Professor Dr. Naoko Iwasaki, Waseda University, and also she's the chairwoman of the APEC project on technologies for healthy aging. So please, Professor Iwasaki.
Thank you very much, Chair. Good morning, and everybody. And my name is Naoko Iwasaki, Professor of Institute of E-Government, Waseda University, and Chair an APEC project on technologies for and healthy and aging. And also, I'm a president of an International Academy of CIO Japan, and also Deputy Director and APEC E-Government Research Center, and so on. So thank you very much for inviting me to the very fruitful conference today. And this is the first time for me. And so today's my topic is the global challenge for the human-centric and aging societies. So lessons learned from the nursing care at home in Japan. So needed nursing care for the elderly to COVID-19. So we have a lot of issues. How to realize as a society no one will be left behind in super aging societies, and is it possible to provide nursing care without leaving job? Because in Japan people tend to quit jobs to take care of their parents, and we need more knowledge and information of home care, and we need long-term care and elderly facilities. And who is responsible for the nursing care at home? And shortage the number for the long-term care and skill education for family members in 2050s. And since Japan will be a #1 super aged society at the time. So they are the various applications and monitoring and services on nursing care for the aging. So this is at the screen of a smartphone. The aging people can get a lot of information and data, and such as the climate or the news or disasters and the smartphones. And also, the aging people can get the news from the municipalities and the government and through smartphone as well. And there are a lot of other movies and about the YouTube and how to care at home or how to exchange a diaper and so on. And next slide is a variety of nursing care robots and technologies for other aging societies. In the nursing care and welfare and sectors, there are growing expectations for the supplementation and support of human functions by a robot. And the robot can care for the people and help care and givers. And also, and the communication robot, unlike an Apollo, and it gives the people peace of mind and also useful for the dementia and preventions and so on. And the most important issues of nursing care at home and how to achieve skills by ICTs. So there are a lot of issues from the aspect of the software and hardware. And the family needs to provide safe and secure and 365 days a year and 24 hours a day in the emergency. And we need to achieve long-term care and medical care and end of life support. And we need to learn an assistance or meal, elderly and care. An economic foundation and whether the patient life is enough or not of human resources and how to develop these resources such as the caregivers and the families and counselors, communities and based and comprehensive support centers. And we need more the knowledge, information and experience and how to create as a reason for living or health and happiness. And from the aspect of the hardware, we need to establish an infrastructure and facilities for the aging, the barrier-free, and maintain the mobilities. Education is important, and infrastructure, smart house to monitor the aging people at home, and the facility as the communication, community expansions, and building an academic center plays a very important role to solve these issues and cooperate with the government or business sectors and academia and NGO and so on. And the necessity of a national strategic and special zone to realize these digital silver cities. And finally, my suggestion is as follows. And first, using emerging digital technologies, we need to train home care leaders annually through video-on-demand lectures and to collect and innovate and big data families and long-term care and utilize them in the silver market by AI. The United Nations should take the initiative to provide a place for long-term care knowledge and education by utilizing the emerging technologies for long-term care leaders, like family members, towards the future, and when almost two-thirds of elderly will be home-based. And finally, the United Nations should be a leader for the new framework for nursing care project to increase the aging quality of life and with NGOs under SDGs. Thank you very much.
Okay, thank you, Professor Iwasaki. And you mentioned about the importance of family members to be nursing caregivers at home. That's very important and need really educational institutions in the future. Okay, so next speaker in my list is Mr. Stefan Ezel, Vice President, Information Technology and Innovation Foundation in Washington. Stefan, please.
Hi, Toshio, thank you. If the previous speaker can stop screen sharing, I can share my screen. Thank you. Well, good day, and thank you, Toshio. I'm Stephen Ezel, the Vice President of Global Innovation Policy at the Information Technology and Innovation Foundation. We're a Washington, DC-based science, technology, and economic policy think tank dedicated for advocating for policies driving global innovation. And as we're discussing today, there's no question that information and communication technologies like AI and telemedicine have played a critical role in helping humanity get through the COVID-19 pandemic. In fact, in the United States, the use of telemedicine has increased by 64% in the year 2020, and it's expected to grow ninefold from $50 to $450 billion globally over the next 5 years. There have been some really cool innovations in the US. One is TidalCare, which offers the first all-in-one modular device and telehealth platform for on-demand remote medical examinations. And it has really cool attachments like otoscopes or stethoscopes that you can actually pick a device, stick it inside a patient's throat or ear, and it communicates in real time with doctors and allows for examinations. Virtually every single hospital in Israel is now using TidalCare as a remote patient monitoring and care solution. Another cool device is Xander Guardian, which uses AI algorithms to remotely detect falls or patients' vital signs in hospital or nursing care settings. AI has also played an important role in helping directly combat the pandemic. For instance, doctors in France have developed an open source AI tool that can help predict likely severity of COVID-19 in specific patients, whether or not they'll likely need to be hospitalized or intubated. It's doing so with 82% accuracy within the first 2 minutes of the patient showing up at the hospital. Another cool example is Canada's FaceDrive Health, which has developed TraceScan, an open source AI-based algorithm within smartphones. Essentially, it's a contact tracing app that can warn individuals of COVID-19 exposure based on geographic proximity. It's helped Canada in its pandemic response. Beyond the pandemic, artificial intelligence technologies play a very important role in facilitating digital inclusion. For instance, a company called Allcove has a virtual reality system on Oculus, where kind of multiple generations can get on the Oculus virtual reality headset at the same time and go hiking in the Alps or on the beach in the Caribbean. So it's a virtual technology enabling multiple generations to be in real time online to facilitate social engagement. Another really cool example is Microsoft's Project Tokyo. And what that is doing is essentially turning visual data into audio feedback, enabling blind people to actually listen to the content of photos. Another example is Amazon Alexa, and they have developed essentially sign language interpretation. So a deaf individual can go before a computer and sign language can ask a question, can interact with the computer, what's the temperature in New York today, and it gives feedback in real time. Another really cool example of AI in health today is what's called multi-cancer early detection. Essentially, companies like Menlo Park-based Grail or Thrive can detect as many as 50 different types of cancers from a single blood draw. Their tests are identifying the cancerous tissue with 93% accuracy and a false positive rate of less than 1%. Essentially, the technology uses AI algorithms to detect circulating tumor DNA in the body. And this is enabling us to screen for cancers that we never had before a guideline-approved screening test, enabling us to find cancers at a far earlier rate when treatment prognoses are much more likely to be positive. And this play a critical role in helping the COVID-19 induced shortfall in cancer screenings. We're expected to have 10,000 excess fatalities in the US this year because cancer patients weren't able to go and get screened or to receive care. These technologies can play an important role in making up that shortfall. So overall, why should ICT innovation be an SDG priority? Well, digital transformation enables more remote activities, making physical distancing more likely and more productive. ICTs enable remote provision of health, education, and government services, while also connecting individuals to global marketplaces, enabling remote work. If you look at like online marketplaces like Etsy, they now connect 2 million people in developing countries to global marketplaces where they can sell their wares. And that matters when 86% of job growth in developing nations comes from small businesses. So what are some policy recommendations in conclusion? First, we would call upon the UN and policymakers in nations worldwide to join and expand the Information Technology Agreement, the ITA. This is a trade agreement that eliminates tariffs on trade historically in ICT products like semiconductors, but it's now been expanded to eliminate tariffs on trade in medical devices like ventilators or like remote diagnostic technologies. So this can help play an important part in decreasing the cost of medical device trade globally. As ITIF wrote in a report last year called Building a Global Framework for Digital Health Services in an Era of COVID-19, it's critically important that we be able to effectively facilitate interoperable exchange of health data among nations. Viruses do not stop at borders, and therefore the health data we need to combat the virus has to be able to exchange globally while protecting individuals' privacy rights. Policymakers must make it a priority to ensure citizens have access to the internet and prioritize the deployment of the broadband mobile infrastructure that underpins these technologies. We need to recognize that digital literacy is a critical aspect of technology uptake and help elderly citizens understand how to use these technologies. Countries need to adopt innovative regulatory approaches to approve medical devices using novel technologies like AI. For instance, the US Food and Drug Administration has created a digital health unit and now has a special regulatory pathway for the approval of medical devices using AI technologies. 2 final points. Countries should engage with the World Health Organization's Digital and Assistive Technologies for Aging the Data Initiative, an important way to help spread these technologies globally. And lastly, we would invite think tanks from countries around the world to join the Global Trade and Innovation Policy Alliance. This is a network of 45 think tanks we've created where these think tanks come together to exchange and advocate for a positive vision of trade, globalization, and innovation for the benefit of humanity. With that, thank you so much, Toshi, for the invitation to participate today.
Thank you very much, Stefan. And we are very appreciating your excellent policy recommendation, and we really analyze the content and make some proposals to United Nations later.
Thank you.
Okay, next is Professor Dr. Suhono of the Bandung Institute of Technology, Indonesia. Also, he's the chairman of the Indonesian Smart City Consortium initiatives. So, Professor Suhono, please.
Thank you, Professor Obi, and good morning, good afternoon, good night, everyone. Well, as an invitation, I would like to share about the topic with the innovative technology for smart city in Indonesia. Of course, the objective is to creating a sustainable development goal, and of course, now the situation with aging people and COVID-19. Well, I think because in urbanization, the problem in society, there are a lot of gap between city and village, and then the number of population in the city is nearly the 60%. So the problem for the convenience and for the quality of life in a city is now solved for our increasing the quality of life. The problem inclusive is in Indonesia, not yet aging people, but the young people more challenges in Indonesia. But of course, aging people is one of the issue in Indonesia. And then because in urbanization, there are a lot of problem in the energy serve, also transportation, mobility, and also some management in Indonesia. Of course, include is COVID-19. And based on the problem aging people like cities, communities, climate and energy as a sustainable development goal issue or challenge, we need innovative solution, include technology, people, process, and how to get the data. If you know with the problem with the time, and if we solve with the conventional way, the gap between the problem and solve problem become wider and wider. So we need a jump solution. We call it transformation, smartization, or digital transformation. That is a main problem. Main challenge is how to get the real situation in our life, include condition of the aging people, include transportation, include the energy, include the waste management, and so on and so on. So based on the situation, we know with why the problem rise, and also what will happen, what should we do. Thank you for the information and communication technology and the smartization solution, so that we can jump up, solve our problem. So sensing, understanding, and acting based our challenges in healthcare and mobility, well-being and property, education and learning, and so on and so on. And in Indonesia, we proposed a model, we call it a smart city model, Garuda Smart City model, based on the resources enabler. Enabler is people, governance, and also smart infrastructure, technology, and environments. And we also, based on sustainable development goal, 3 of the cluster must balance: economy, society, and environments. And of course, we try to get the how to improve the quality of life, like a basic value and the smart value. Of course, aging people and COVID service now is our consideration. And we are developing a digital twin on a smart city living lab to understand the situation in our city using a sensor like environmental sensing, video sensing, and another sensing, such that we know what the real problem, and then we transfer to cyber. This is cyber to physical system, and we call it a city living lab. We try to understand the real situation in the city or in the area, in the energy, in a safe and secure city, and healthy, and so on and so on. Then using the artificial intelligence, using the data analytics, we understand real time the problem in our life. This is our innovation with smart CCTV, the artificial intelligence for the home care, or for the traffic, or for our safe and secure area solution. We call it the Viana, video analytic with artificial intelligence. You transform the conventional situational awareness to become a smart situational awareness, and we call it a digital twin. This is one example of the application in COVID-19 with how to understand, how to observe the social distancing, and also the masker, head map temperature, and so on, so that we can enforcing the health protocol. This is one of also a collaboration between Bandung Institute of Technology and Massachusetts Institute of Technology with the Professor Carlo Ratti, MIT Indonesia Research Alliance with we call it Instagrammable city, to know what the situation in the dangerous using artificial intelligence to reduce the earthquake using artificial intelligence. This is one of our ongoing research with MIT and IDB to understand and to reduce the earthquake using artificial intelligence with the category environmental and climate science, society and environment. Yes, this is our presentation. Of course, we open to make collaboration with our institution and also the international organization. Thank you, Professor Robi.
Okay, thank you very much, Professor Hono. And I think smart city can accommodate the aging people with quality of life. And Indonesia has very interesting models on that. Next speaker is Kun Airada Luandi Birai, a Senior Executive Vice President of the Digital Government Development Agencies, Thailand. Please.
Okay. Sawadee ka. Hello, friends from around the world. Glad to see you. Glad to meet you all here, and we are all safe from COVID-19. Firstly, I would like to thank Professor Obi and the virtual site event for inviting me to share about digital technology for aging society in Thailand. Today, I will talk about some examples of digital technology that we deal with our aging society, which cover three significant issues. Firstly, status of aging society in Thailand. Secondly, digital technology for health and well-being of the elderly person. And lastly, how we help them access their welfare age pension more easily. Okay, it's estimated that Thailand will become a complete age society with about 20% of our population will be 60 years of age or older by the end of this year. 14 years from now, in 2035, we will become a super age society with the ratio of elderly person will reach 25% of our population. Therefore, aging society become the reality in Thailand. As we all know, health data information is very important in promoting prevention, treatment, and rehabilitation of the elderly person. In the national public health system of our country, apart from healthcare professionals, we also have village health volunteers or VHV. They are ordinary people with public mind and trained for fundamental healthcare knowledge and skills. During COVID-19 pandemic, the volunteer worked hard to raise awareness among local people of how to prevent the infection. The volunteer also helped healthcare professionals find the infected, close contacts, and monitor self-isolation, leading to Thailand's success in controlling the COVID-19. When it comes to looking after elderly person, the volunteer will be equipped with digital tools to correct elderly person's health data and facilitate health screening. Data will be stored in the aging health data system, through which the data will be integrated and shared among healthcare professionals from the local level to the specialized hospital in the major cities. The entire process shows how the government and ordinary people can work together in partnership to provide better healthcare service for the elderly persons. So I wish to stress here, in order to achieve the SDGs, the government working alone model is outdated. We need to work together with other actors, especially ordinary people in the community. We need to share our strength and resource as strategic partner in order to success. However, some elderly persons are more vulnerable as they easily disappear or get lost due to Alzheimer's and some mental illness. The Thai government therefore works in partnership with a civil society organization, the Miller Foundation, and other private partners to develop the system called Worry-Free Missing. Relatives of elderly persons in Thailand and can register their personal data, the application called Time Missing. They can also request wristband for the elderly person to wear, which wristband contain a QR code linked to the Miller Foundation database. In case elderly persons are gone missing or get lost, a person who finds them or a police officer can scan the QR code on the wristbands. Only the contact details of the Miller Foundation appear. Our staff will then be able to contact their relatives. Regarding welfare, now elderly persons in Thailand receive a pension every month, 600 baht or about $20 when they are 60s. And it will increase 100 baht or $3 every 10 years. And the pension is capped when they are 90s. In order to receive a pension straight away after turning 60, citizens are still required to visit local government office to register themselves with local officers. However, when they need to register is different, depend on their dates of birth. Currently, we still have a problem. If they fail to register within time frame, they could lose 7,200 baht or about $240 altogether. Unfortunately, it's too hard and complicated for elderly person to manually find out when to register. Therefore, we design a digital system to find out the registration period for each individual. Each elderly person simply fill their dates of birth and press a confirm button. We will be launching it in the near future. Moreover, we are trying to integrate welfare and entitlement data from various agencies When the data is fully integrated, one-stop service for citizens will be launched. What lesson can be learned? Apart from working in partnership with people, as I mentioned, we find that simplicity is the key to success. When we design digital system for elderly person, digital for all is the principle that we must strongly adhere to. We must not leave everyone behind. Thank you for your attention. Happy Chinese New Year to everyone. Be happy, healthy, and safe from COVID-19. Thank you.
Okay, thank you, Kun Airada, about the Thai government comprehensive policies toward aging peoples, especially how to use the technologies for them. So next speakers from Singapore, Professor Dr. Sen Yin Len, Nanyang Technological University. Please. Professor Sen. Yes.
Hello, can you see my slide?
Yeah, looks like yours.
Okay, thank you. So you can see the PowerPoint slide. Thank you so much. Thank you for the invitation to present. Yeah, so I think for this presentation, I would like to actually, I know the topic is on digital technology. I'm looking at the, the benefits for aging society. For this, presentation, I would like to focus on the people, using the technology and how we can actually encourage the community to also participate in helping the older adults use technologies. So I'm the Executive Director for Aging Research Institute for Society and Education at NTU, and this is a Penn University Institute looking at aging, research. Right. So I'm going to talk about a study that we have just concluded. We did this study from November to February. The whole idea is actually to look at, the use of the technologies. But because of COVID restrictions and social distancing, the older adults are not able to,
Professor Chen,
yes.
sorry, and we cannot see your slides.
Oh dear.
Can you show
Sorry.
us?
Yeah, okay.
We wait. Yeah, thank you.
Okay, yeah. You can't see my slide.
Oh, not yet. You are at the screen of your desktop.
Okay. Sorry.
Mm.
Can you see it now?
Yes, great.
Oh, good. Thank you so
Please go
much.
ahead.
Sorry, then I've been going around without showing the screen.
Thank you very much.
Okay, so so as I mentioned, we did the study is really to it's only a few months, but we wanted to actually see the use of technologies, combined with people who actually help to use the technology. And I'm glad that our presenter from Thailand actually talked about using volunteers, and this is actually what we wanted to test out, to see whether using volunteers to help in using the technology, can we actually get the elderly to accept the technology more readily. So because we cannot go to the homes, so we have actually looked at contactless process. And the whole idea is whether we could actually match some of these like health services and with guided coaching through telecommuting software. And we wanted to actually look at the efficacy of contactless health coaching. There is the web-based application versus the mobile application, and this is actually using AI to match the right health coach to the right elderly person. Now, what we actually did was to recruit volunteers, train them, did a pre-study, pre-survey to look at the older adults and the conditions, as well as some of these measurements. The health coach conducted 4 Zoom sessions, and 21 of them finished the sessions, and we actually recorded their feedback, and in terms of not only their exercises and also their health, the diets. After that, we actually did a post survey. In terms of volunteer training, we had, we actually looked at some of these basics in terms of training. One of the challenges that we face is that we have elderly, volunteers, right? But they are not trained. So when it comes to providing help to the the elderly, many of these volunteers may not be able to provide the right kind of counseling and advice. And we wanted to actually look at health coaching basics, nutrition and exercise, right? And there are 4 sessions, and each of the sessions, the elderly, the coaches will be building up rapport with the older adults, and setting goals with them. And the whole idea is actually to engage with the elderly. Why do we do that? Because, as the elderly actually use the technologies, they may not be so conversant. Having some human coach to be able to coach them in terms of healthy and active living, that's important. And in our preliminary results, we see that there have been improvements in active aging. In terms of improvements in exercises as they actually work with the health coaches. The challenges that the elderly face is that they could be incurring physical injuries, emotional reasoning, as well as the restrictions for outdoor exercises. The other thing is that, for the improvements, we also see eating choices and behaviors change. And that is very encouraging because with, with coaching in terms of eating healthily, we see that there have been changes in eating in variety, moderation, eat less of the sugar and more positive impact. So one of the, so this is actually just one of the small studies that we have done. In fact, over the last 10 years, we have been looking at ICTs in encouraging elderly to exercise, to, to age healthily and to eat, healthily. And so far, we have actually been looking at almost more than 2,000 subjects. And I would like to actually also, emphasize here that technologies are important, but understanding the people to use the technology so that, there is more acceptance and adoption. So what have we learned from this small study? Over a period of 10 years of studying ICT for older adults, COVID has given us a very unusual situation. We have been actually talking to, the older adults, the community centers, and there have been, reservations in using, but COVID has accelerated the technology acceptance and adoption. And, the older adults are very keen, very open, like in using new technologies. Although some of them are not familiar with digital devices, some may not have, and and training and accessibility are needed if we're talking about innovative e-learning, e-aging. The other one is, as we actually work with the elderly, the one thing that, the desire in their hearts is to age in place, in the homes, in the communities that they're comfortable with, in the environment. And that's the reason why when we actually tested out on health coaches, is really bringing the community volunteers to help the elderly in the community itself. And this encourages, acceptance and adoption of technologies that can bring healthcare services to them. Companies are beginning to find that it is, important to look at ways to develop or to deliver solutions to the older adults, because they see that there's a need to be connected and protected, right? I would like to say a little bit about this ARISE, the Aging Research Institute for Society and Education, that the NTU is actually has been doing work for the past 5 years, and we wanted to actually look at healthy, active, and independent individuals. The older adults, as we actually look at them, they are aging, but I think there's a lot to celebrate too. In terms of giving meaningful social integration and productive through technologies. And the important thing is actually to have a deep understanding of aging-related and psychosocial issues, so that we can empower the aging community and improve the quality of life. So I'll stop here. Thank you very much. And the project has been actually funded by ARISE as well as the National Research Foundation. Thank you so much.
Okay, thank you very much, Professor Sen In Ren. And you are talking about contactless health coaching for older adults. Might be quite interesting for us. And, maybe we can continue to work with you on that research. And so last speaker today is the Professor Dr. Yang Feng-Chun, Dean, Institute of E-Government, Peking University, China. Professor Yang, yes.
Thank you very much. My topic is the China agenda and practice in how to deal with the difficulties of elderly in the lockdown cities and communities.
Professor Yang, can you make a video on?
Okay.
Yeah, I
Okay.
cannot see you and. I don't know. So I see. Are you shy or?
Yeah. Okay.
Okay, fine. Okay.
The first is I want to introduce the current aging situation in China. In 2019, the number of people aged 16 and above in China had reached to 254 million, accounting for 18.1% of the total population. In some big city, for example, like in Beijing, the number is 3.7 million and accounting for 17.2% 24%. In Shanghai, the number is the figure is very much. The number is 5.18 million and accounting for 70.24%. I'm sorry, in Shanghai, the accounting is 35.2%, and in Nanjing, the number of people aged 60 and above is 1.6 million and accounting for the 22%. Next, I want to introduce the effect of digital COVID-19 prevention and control measures on the daily lives of the elderly. You know, in China, a lot of cities and communities in cities and rural areas sometimes lock down to confront the COVID-19. In this situation, these measures has caused a lot of problems to the elderly. For the reason is the elderly, the reason is in 2019 there were more than 900 million internet users in China, but only 6.7% of them were aged 16 and above. And their ability and use frequency of the Chinese elderly population in use internet service are lower than this of other aging groups. And nearly 200 million Chinese aged 60 and above have never had access to internet, and many of them do not use the internet or smartphones. The number is very large. With the rapid growth of the elderly population in China and the wide use of digital technology, the elderly population has encountered more and more difficulties in daily, for example, in daily travel, seeking medical treatment and other types of consumptions. Especially the use of coding scanning, faces scanning, mobile payments, and online bookings have become a normal part of life. This have brought more troubles to the daily life of the elderly population. In some local down city and communities, health code mobile phones have become access permits. And if you have no health codes, you can't to go out, to travel, to shopping, to seeking medical treatment and receive other services. So it's very difficult for this elderly. In this situation, in November 2020,
Okay.
I'm sorry.
Yeah, it's okay.
Yeah.
Some difficulties for
Yeah.
language, but yeah, I understand very clearly about the situation in China. And, since we will publish the book later on these issues, maybe you can write down the paper. Thank you very much. And we have two commentators on these presentations because they are well-known professors. First one is the Professor J.P. Offlet, President, International Academy of CIO, and the Professor of George Mason University in Maryland, United States. So, Professor Offlet, please.
Thank you very much, Professor Obi, and thank you everyone for joining today and tonight and this morning also. And thank you for all the wonderful talks. I'd just like to highlight a couple of points and how all the speakers' talks tied in wonderfully to Minister Yoshida's talk, where he highlighted the system of ICT usage for the elderly, especially elderly at high risk, and also highlighted how with COVID, it was the digital technology provided a new tool. And while we lost many things, there are also many opportunities and lessons learned from the crisis. Professor Iwasaki gave a wonderful talk on nursing care at the home and the wish of many elderly to age in place and at the home, and the potential and actual use of digital technologies, and some of the challenges of long-term care at the home, with 2/3 of the elderly projected to be home-based. And Professor Iwasaki highlighted some of the technologies from Japan for aging in place and staying at home. Dr. Ezel highlighted some of the technologies in use in the US for COVID and with the aging, including on early detection, sentinel-like technologies that can detect healthcare issues early, especially with social isolation. Professor Suhano tied the Aging Society topic to smart cities and also broadened it out to smart cities and the risk of COVID, but also some of the risk from natural disasters, which Indonesia is prone to with earthquakes and tsunamis. And then Hereda Luravile brought up the community aspect of aging society and the importance of community, including with this very interesting initiative of VHV for community screening, and also highlighted how the Thai government is very proactive in setting up a system to actually contact the elderly when they become eligible for pensions to streamline the onboarding. Professor Tang also highlighted the community engagement with volunteers from the community and this idea of how best to match the volunteers with the elderly, and also highlighted the work that she's been doing with NUS the last 6 years on aging and working with the elderly population. And then lastly, Professor Yang provided an overview of aging society in China. 2019, 254 million over 60 years old, 18.1%. And Professor Yang highlighted the potential of technology for social isolation during of elderly during the lockdowns, but also the challenge of internet adoption and internet usage. So thank you all for your wonderful talks, and they tied together a fantastic way. And thank you to Professors Obi and Iwasaki for the organization.
Okay, thank you, Professor Offlet.
I will join with, agree with GP words. Thank you everybody for participation. Jean-Pierre provided very detailed analysis, and actually I would just add that events like this very important for all of us, because it is a real exchange, the best experience, and I think participants will find something which would be useful in their country. And I also can add that we have, some changing in comparison with the pandemic started, because now people collect a lot of data about the COVID, and we can think how we can use this data, use machine learning technology for predict, I don't know, different things concerning to the COVID. And we also capable to collect some our experience in artificial intelligence framework, in something like knowledge graph, and think about this, how we can be well prepared for the disasters like this. And taking into account all these, arguments, I would say once again, thank you, Professor Obi. Thank you, Professor Iwasaki, for your great efforts and great results when people collect together and have a possibility to share the best experience. I think it is extremely, extremely important for all of us. Thank you.
Thank you very much, Professor Alexander from Moscow. And I think we can have 2 or 3 questions from audiences, or if the 6th speaker want to add some more point, you may have a little bit time. So, are there any question or comment? Or speaker can add something more about your briefings. No? Are you satisfied? Yeah, you can raise your hands and then you can have a chance. How about Professor Iwasaki? You are the first speaker.
Yes, thank you, Professor. Thank you very much. And today I could learn a lot. And so today I introduced the nursing care at home, but if possible, I want to mention about the relationship between digital government and the digital divide of other aging people. Is it okay?
Yeah.
Mm-hmm. And according to our result of social survey, digital technology will expand the digital divide of aging people, and collectively the quantity and the quality of information will expand the divide, I think. And how to minimize the divide among the aging peoples. And for example, in Japan, 80% of the aging is active, at least 20% of the aging is not. So therefore, to create a digital society which people will not be left behind, a smartphone will be a key tool to reduce the divide of aging peoples. Now in Japan, the government prepare for establishing a new digital agency and implement a digital government through the smartphones. So the issue will be how to create 5G mobile government. So we and Waseda University and IAC and PRESS released the World e-Government ranking for 15 years. So in the future, to strengthen our digital government will be more important for us. So according to the research, the high ranking of digital government can increase the index of happiness. So therefore, how to implement the happiest in the countries. The most important thing is the 5G mobile government, the high quality mobile application with user interface and the user experience. So thank you very much.
Okay, thank you very much. And how about Pingy from Indonesian government? Do you have any comment? Pingy.
Thank you, Sensei. Regarding this topic, I have no comment on this.
Okay.
I think the presentation is good. I can take learn from all of the presentations. Thank you.
All right. How about Diana from Russia? Do you have any comment?
Hello, everybody. Thank you for a wonderful presentation. It was really interesting because you could see different approach to the same problem. And one thing which was always with me in each and every presentation is the question of adoption. Because we're talking about different technologies, first, like technologies for personal use, technologies which are used by nursing homes. How to increase the adoption? I think the financial problem is something that comes to my mind at first, because we're talking about innovations, which at first are quite expensive. How we can facilitate the adoptions of very innovative technologies so that can be used widely by the elderly. That's quite a difficult problem, I think, to tackle. And if anybody have any suggestions, I would love to hear. Thank you.
Okay, thank you, Dr. Diana. Who else? How about Stefan? Do you have the last word?
Well, I would say that the pandemic presents an opportunity for transformation. If you look, for instance, at telemedicine in the United States, as recently as 2 years ago, most insurance agencies or many insurance agencies wouldn't accept telemedicine. It was a very state by state whether or not it was acceptable. And now the pandemic has kind of forced national adoption of telemedicine, right? So it's an opportunity for transformative adoption of these types of technologies. I think another consideration as countries around the world put in place COVID-19 recovery packages is that the deployment of these underlying digital infrastructures, as well as the opportunities to bring more of these technologies into hospitals and health systems needs to be a priority. If you look at what Europe is proposing now with their $145 billion or over 145 billion euro recovery package, about 20% of that is going to go to digital technologies. So I would encourage policymakers in all countries, while of course we need to respond to the immediate needs of pandemic, diagnostic testing and allocations for vaccines and therapeutics and economic recovery, to think about how a portion of those funds can go to structural, the long-term transformation that can facilitate the broader adoption of these types of technologies.
Okay, thank you very much. Okay. Anybody else? How about JP Offred, professor again, and he was the president of International Academy of CIO. Do you have any point to be added?
Oh, I think so. I think adding to well, all the speakers and especially Professor Yang's and comments on the digital divide, that there's great potential and actually great accomplishment during COVID and before with technology. The countries that have done best technology-wise through COVID has partially been because of their investments in digital government over the last 20 years. And so the countries that have not been able to invest and have a risk of falling further behind. And there's also this divide, as pointed out, between rural and urban, in between the elderly and the younger. So I think the digital divides, as digital technology becomes more important post-pandemic, is also an increasingly important topic.
Yes, yes. Thank you, Professor Offred. I agree to your point. Digital divide by digital technology itself might be a very critical point in the future. Okay, so almost time out. And
if I could add one final point.
Yeah.
It's the importance of countries committing to learn from one another. I always remember Japan has this thing called SmartWay. It's this nationwide intelligent transportation system where you can get real-time information into the driver's vehicle about the nationwide on driving conditions. Japan deployed that system in 5 years. It took America's Department of Transportation 5 years to study even the feasibility about whether that could be done in the United States. So because we refused to listen to and learn from the smart things Japan was doing, we wasted 5 years that we could have been putting such a system in place. So I would encourage the policymakers here at APEC, right, to develop inventories about the great technologies and digital solutions that have been offered here, and to find structured ways that we can have dialogue and deployment and exchange and uptake of these technologies across countries, because in so many cases, these things are there now, and it's just a question of how we can get them into nursing homes, into individuals at home, so that we can really deploy these technologies to improve outcomes for citizens around the world.
Yes, thank you very much, and very good point. And, yeah, home caregivers or home nursing project might be very important in the future, not only Japan, the United States, but all over the world. And the United Nations must handle all these issues. Okay, so it's almost time out, and just I give you my very, very short comment, and Mishima-san shows in my comment. Yeah, conclusion and the proposals. One is the digital technology can promote smart life, health, human rights of the older persons who are not burden and cost, but the asset and the educator. Secondly, digital technology will innovate, consolidate global online training education for all families with seniors at home to become home caregivers. This is a recommendation by Professor Iwasaki too. And the last one is World Summit on Digital Silver, Aging Society and the SDGs be held by United Nations and civil society in the future. This is my conclusion, the proposal. And thank you very much for your kind participation, and especially fantastic presentation by 6 speakers, and excellent comment by 2 professors. And I hope we can meet again, because the Waseda University and Japanese government and the UN, also NGO aging, hosting the side event every year at this moment, and maybe we can meet again next year too. So this is the final comment by moderator. See you again.
Thank you so much, Professor Obi.
See you.
Yeah, thank you.
Thank you very much.
Bye-bye. Bye.
Bye bye. Bye bye.
Thank you.